Hey guys, in this video, we're going to talk about ankle and foot spasticity after a stroke. Welcome to Basically Physio. My name is Suresh and I'm a physiotherapist. In the first part of this video, I'm going to explain to you the theory behind spasticity, and the second part, I'm going to show you practical exercises that you can do for spasticity. So do skip along in the timeline where you want to watch for this video. So what is spasticity and how does it happen? You can think of spasticity like an overreaction of your stretch reflex mechanism that happens in your body after a brain injury or upper motor neuron injury. So why spasticity develops is because of this. Your brain in a normal setting, in a normal healthy brain, it is actually exerting an inhibitory effect on the stretch reflexes of your body. This inhibitory effect actually is able to help you to regulate your movements and give you a very controlled movement that you can do in your limbs and your body. But what happens after a stroke or brain injury is that this inhibitory effect is much lesser now because your brain is affected, and overall there's going to be a lot more excitatory effect that is happening because the inhibition is lost. There is a net excitation that's going to happen for your stretch reflexes, and when that happens, your movement control may be affected and your movements will be affected after a stroke. And what you notice in this situation where there's an overall excitation of this stretch reflex is that the movements are going to be out of control and you're going to see involuntary movements and also a lot more higher tone. These are things that you will experience in your upper limb and your lower limb. So this is why spasticity develops, is because this braking force of the brain is lost or much more diminished because it is affected and injured because of a brain injury or a stroke. So in your lower limbs, how does spasticity affect your walking? Usually for a stroke or brain injury, when your limbs are affected by spasticity for your lower limbs, what is going to happen for your ankle especially is that it is going to be pointing downwards and it's also going to be turning inwards. This is what we call plantar flexion and inversion. Plantar flexion is pointing downwards and inversion is pointing inwards. Okay, this too is a very classic case of how spasticity can happen or show in your lower limbs, and this is happening because there is going to be overactive gastrocnemius and soleus. These are the two muscles of your calf areas, and also your inverters, the muscles that help you to invert your leg. These are also going to be a bit more affected by spasticity. And when this happens, how it affects your daily functions is that your walking is going to be affected and your transferring ability is going to be affected. How it's going to be affected is whenever you're going to be walking, when you're swinging your affected leg, what is going to happen is that because your feet is pointing downwards, it is not able to clear the ground as effectively. And when this happens, usually you will compensate with your hip or your knee by bending it more. But if you're not able to compensate, then you're just going to trip and fall down. So this is why it affects walking. Now in transferring, what happens is that when you are going to transfer from your bed to your wheelchair, you will have to do a little bit of a standing or at least weight bearing through your legs. And when your leg is not able to take on the weight because your feet is pointing down, then your transferring ability is going to be affected because it's not going to be as easy as it used to be, or it's not going to be as safe as it used to be. So this is why spasticity in your lower limbs can affect you mainly in your walking and your transferring ability. And this is why it's important to tackle when you see the first signs of spasticity developing. Now, as we talk about spasticity, it's important to distinguish between a foot drop and a spasticity. Foot drop and spasticity may look like the same thing, but it's actually underlying mechanism is very different. So what a foot drop and a spasticity may look like is your ankle is actually going to be pointing down for both of these conditions. But in a foot drop, this ankle is pointing down, but if you take your other hand to help your ankle to move up all the way, your ankle will be able to move up, meaning that the range of motion in your ankle is present. And what this means is that your muscle strength is weak, but you do have the range. This is the main difference between a foot drop and spasticity. For spasticity, your feet is pointing down, but if you take your strong hand and try to move your ankle, you may not be able to move it much. You may not even go up to neutral. And this is because of the overall overactive muscle activations that's happening in your calf muscles and also your inverter muscles. And this actually means that you do not have the range as compared to foot drop. Foot drop, you do have the range because you are able to passively move your ankle up, but in a spasticity, you're not able to passively move. And this is an indication that it is spasticity or there's tightness in your calf and your inverter muscles. So this is the main difference between a foot drop and a spasticity. So for spasticity, what is going to help is a lot of stretching and a lot of bracing and using your ankle foot orthosis, and also strengthening muscles that are in controlling your ankle. Talking about bracing and ankle foot orthosis or AFOs, these are actually very good adjuncts that we use when you have foot spasticity. So what these can help you to do is that normally if you do not use any brace or AFO, the effects of gravity is just going to pull your ankle downwards and inwards, and this is just going to affect you negatively. But if you are able to put a brace or ankle foot orthosis for your ankle, what is going to happen is that gravity no longer affects too much, because you are going to be blocking it with a brace. So your ankle is going to be held in a neutral position or up to 90 degrees and in a more neutral position, and the effects of gravity is that it will not be able to push down because there's something going to be bracing your ankle against it. And this is why ankle foot orthosis or bracing can help to prevent worsening of your spasticity or contractures that you may have. But the truth is that you cannot rely on bracing and ankle foot orthosis all the way. In therapy, usually what we do is that we do our therapy with and also without the ankle foot orthosis, so that you can actually train up your muscles when you have the ability to do so. What happens when you use your braces or your ankle foot orthosis for very long periods of time is that you may end up becoming too reliant on it. And the tricky thing that happens is that over time you may develop some strength gains in your ankle, but you may not realize it because you're too reliant on your ankle foot orthosis or your brace. And this actually just gives you the perception that your ankle is forever weak and you're not going to be able to move it. But in fact, you may have the strength that is developing in the background, but you just are not aware of it because you're too dependent on a bracing or ankle foot orthosis. So this is why you can use this as an adjunct, but not the main form of treatment for all your ankle foot orthosis and spasticity cases. So I'll be linking some products in the description below. Do check them out if you find that this might be useful for you. So now I'm going to move on to the second part of the video where I show you practical tips to manage ankle spasticity. So we're going to start off with warm-up for your stretching for your ankle first. So the socks that I'm wearing on this ankle, this is the stroke side that I'm showing you. So first thing what we're going to do is using a stronger hand, you're going to help to bring your leg up this way and put it over the knee down here, okay? So using a stronger hand, I just want you to move your ankle in all four directions. So you're going to go upwards as much as you can, you're going to go downwards as much as you can, you're going to come inwards as much as you can, and you're going to go outwards, okay? A tip is that you can use the entirety of your palm or your hand to grab the forefoot region, or you can grab the midfoot and a bit of your heel also to actually move the ankle up and down, okay? So for me, I prefer the front part of my foot, so I'll go up first and hold it there for a few seconds and down, okay? Alternatively, you can just go in an up and down manner like this as much as you can, okay? So for some of you with the spasticity, you may not be able to go up even to neutral. That is fine. You're just getting a bit of laxity in your ankle joint and just getting it to move as a warm-up, okay? So up and down, you want to do it for about 30 times, okay? And after that, you want to go in and out, okay? In and out, in and out. So when you're doing this, make sure that you're not moving your hip like this, okay? This is not a correct way to do. So just focus on your ankles here and move it in and out, okay? So in and out also 30 times in each direction. So 30 times going in and out, okay? So this is just a warm-up. I don't expect you to have full range of motion like how I'm showing you, okay? Just do as much as you can and as much as you can tolerate. If you find this content useful, do consider liking and subscribing to the channel. Additionally, you can also sign up to my weekly newsletter, Rehab Recovery, for more positive insights and kindness. Now that you have done some movements in your ankle, the next thing I want you to do is I want you to sit closer to the edge of the chair, okay? So you come closer like this. And what's going to happen now is for your stroke side, right? I want you to bring your heel as much back as you can, okay? When you're doing this, a lot of times you may not be able to go back all the way because your heel will lift up, okay? When your heel starts to lift up, that is where you want to stop, okay? So for example, if I go to here and my heel starts to lift up at the back, okay, then I just go forward a little bit more and make sure that my heel is touching the floor. Okay, for the majority of you, you should be able to find an angle that your feet and your heel is touching the floor. But for those of you who are just trying all angles and you're not able to, then just find the one that is most comfortable for you. So once you have found the most comfortable angle where your heel is as close as possible to the ground or touching the ground, and your front of the foot is also touching the ground, then I want you to press down on your knee And also shift your body weight towards your stroke side, towards your weaker side, and shift it and just push it down as much as you can, such that you are able to stretch your calf muscles and also the ankle joint itself. Okay, so go towards and put as much weight as you can, as safely as you can, then ease off. Okay, so I recap again. When you're sitting normally, I want you to sit as close as you can towards the edge as safely as you can, followed by you just want to bring your feet back, your stroke side, your feet back as much as you can until you feel that your heel is lifting off the ground. If you find that your heel is lifting off the ground, then just go forward a little bit more and make sure that your heel and your entire foot is on the ground. In this position, I want you to shift the weight towards your weaker side and using your stronger hand, push down on your knee. Okay, hold this for about 10 seconds and you want to do this for about 10 times. Okay, so we are still in the warm-up stage. Okay, we're just getting the joints a bit looser and the muscles a bit more looser so that we can do the other exercises. Now the next stretching that I want you to try is actually if you're able to get a bottle that is in a cylindrical position or a rolling pin, then I want you to use it and get your stroke side, the leg, right? The foot, just place it on the rolling pin, and I just want you to shift forward as much as you can and roll as much as you can. Okay, roll forward and backwards. Okay, so just using as much power as you can in your knee muscles here for your weaker side, just try to roll this forward and back. Okay, you may not be able to roll forward and back all the way like how I'm showing you, but just a little bit of movement is actually quite good already. Okay, this is just part of the warm-up and just getting you to move your ankle and your feet a little bit more before you do the other more difficult, challenging stretches and exercises that I'm going to show you in a while. So do this for about a minute or two. You can do it for two or three sets. Then you can just continue with all the warm-up exercise that I've been showing you, the earlier two also, and add this as the third one. Okay, so come back a little bit and just continue like this. So now moving on to a little bit more stronger stretches, I want you to get a roll of towel or blanket like this and just try to hook your ankle up. Okay, hook it up like this, okay, to the front part of your feet. Okay, and then in this position, I want you to use your stronger hand and just pull your ankle towards you. When you're doing this, you can actually straighten up your knee. Okay, so I'm going to show you again. Okay, you can actually straighten up your knee like this and then pull as much as you can. You can even use your weaker hand to help pull. Okay, as you're pulling, if you're lifting, if your feet comes off the floor, that's fine, but you just want to keep your knee straight and pulling your ankle towards your body. Okay, pull and hold for about a minute or two. If you can hold for longer, then go ahead, but it will be a bit tiring. So 30 seconds to 1 minute at the start, then after that you can progress the duration as much as you can. So 30 seconds to 1 minute at the start, right? Then repeat it for 3 sets. Okay, so ease off. Okay, make sure your knee is straight, then you just pull again. Okay, yeah. So once again, I do not expect you to have full range of motion when you're doing this, but as you're just getting some movements into the joint, that is a good start already. The next exercise, I want you to get a roll of towel like this and put it on the floor. Okay, and then get your feet onto the roll of towel like this, and same thing, your knee, you flex it back as much as you can, then using a stronger hand and your body weight, I want you to go towards your stroke side and push and hold it there. Okay, the roll of this towel is actually to get your feet a little bit more upward bending so that you can get a bit more stretch. Okay, hold it there for a while. Okay, about 30 seconds to 1 minute, and you want to relax. Then do it for 3 times, but to be honest, you can actually do it many more repetitions, as much as you can tolerate. Okay, these are all good stretching and mobility exercises for your ankle. Okay, hold it there and ease off. Hold it there and ease off. At this stage, I would like to recommend a wedge. This is a product called a wedge, right? It's actually a very foam and comfortable surface that your ankle can actually go on, and it gives you a bit more of a dorsiflexion range that you can do stretching with. So the product is in the description below. If you want to check it out, go ahead and get it. It's a very useful tool for your exercises, especially for your ankle. Now, if let's say you do not want to get a wedge, I'm going to show you an alternative. So the alternative is if you have a chopping board and a big textbook like this, what you can do is just put the textbook here and the chopping board. This is like a wedge that you can improvise, okay? So it gives you an incline for your ankle to stretch on, okay? So in this position, just put your weaker leg onto the wedge, onto the board here, and this is nicely going to give you a upward stretching. So same thing, just go ahead and put more weight on your weaker leg. So putting your stronger hand and pushing it down on the knee joint, just to get a bit more range into the dorsiflexion, okay? Hold this for about 30 seconds to 1 minute and repeat it for 3 times. But like I said earlier on, if you can do more, it is going to be better for you as well. Okay, so really push down the weight onto your feet and your ankle and get you to feel the stretch over at the back of your calf area. Okay, so now we're going to move on to a little bit more challenging exercises. The main thing that you want to do when you have spasticity and tightening of your muscles is actually you want to get into a weight-bearing position. The reason why weight-bearing position is going to be beneficial is because it's going to use the weight of your body and also gravity to get you to stretch for a longer period of time, and this is actually going to be a much better stretch compared to all the other exercises I've been showing you. So the first thing we're going to do is get into a half squat. So I'm going to actually get you to put a chair in front or a support in front like this so that you can hold both hands, but since it's going to block you, I'm just going to not show you with the chair in front, okay? But imagine there's a chair in front when you're doing these exercises. First thing I want you to get into is a half squat position, okay? So using the chair in front, using both your hands to hold on to for support, you just want to get up as much as you can and sit down, okay? So as you're doing this, right, I just want you to focus on putting more weight on your weaker leg, okay? So more weight, I want you to shift towards your weaker leg and really get you to stretch your ankle and your feet downwards, okay? So just go up like this and come down. Okay, this is for a start. But if you're able to do this and this is quite easy for you, then I just want you to go into a standing position, okay? So go into a standing position with 2 hands supported in front and then come back and sit down. So as you can see, when you're standing, this is actually going to be a very good stretch for your ankle muscles and your calf muscles, okay? So now as you're moving on into a standing position, now getting into standing, what you want to do in this stage is that as you are standing like this, I want you to put more weight on your weaker leg, okay? This is just going to force your ankle and your calf to stretch much more. Okay, so at the start, when you are not able to put your feet down on the ground, you really need to have the support. You really need to have to hold on to support at this stage, and you also need to have a therapist working with you because it's going to be safer to do so with a therapist. So in this position, just put the weight in the front of your feet and try to get your heel down as much as you can, okay? So if your feet is touching, if your entire feet is touching the ground, then very good. Just continue weight bearing on this side with some support and coming back. But if your feet is not able to touch on the ground, really hold on to support and get someone to stand by you on the weaker side, and then just push onto this side and come back. Okay, over time, if you're doing this regularly and also taking medications to relieve your spasticity, then you will start to notice some improvements. Okay, so shift to your weaker side and come back with two hands supported. Now going to the much more challenging category of exercises, we are going to do a bit of stepping exercises, okay? So I want you to get into a standing position and I want you to hold on to a support structure either at the front or at the side like this, okay? So you want to stand on your weaker leg, okay? You want to really stand on your weaker leg and you want to do a bit of stepping on your stronger leg, okay, like this. Okay, so this is a bit more high level. I really need you to do this with someone. Do not do this alone because it is very unsafe if you're doing it alone, especially if your feet is not able to touch the ground. Okay, so hold on to support and get someone to stand by you, beside you, and just go forward and back. If you're not able to go forward and back, just lifting up and down also will do the trick. Okay, lifting up and down is a little bit more easier compared to going forward and backward. Going forward and backward. Okay, so all this weight bearing through your weaker leg is just going to help you to stretch out all these muscles, and it's just going to be a much more better stretch compared to using your hand or using a towel or a wedge. Okay, so stepping forward and backwards, this is going to help you to loosen up your muscles and also strengthen up your entire leg. Okay, so for all of these exercises that I showed you, the ones that involve you to weight bear, you want to try to do for about 3 times 10 sets. 3 3 sets of 10 repetitions. So a quick summary of this video is that in the starting, we actually explain about what is spasticity and how it develops and how it affects you in your walking and transferring, and also what is the difference between a foot drop and spasticity. And then moving on to AFOs, I explained to you what is the benefits of using AFOs and why you should not use it for long term, because it is going to be detrimental for you if you are just going to rely on it too much. And then next we went on to the exercise that you can do, firstly in sitting and then progressing into a standing position. So for all of these exercises, do start out with a good warm-up, and also make sure that you are doing it with a caregiver when you're not feeling safe or you're feeling unsure. Okay, so I'll see you in the next video, and thank you for your support.